One thing that we do is train family for them to help and assist the patients, or in some cases to not assist so much, so that we can get towards independence with the patient.
And my kids would come up on Sundays to see Kyle, and they'd take him down to the down to the family room and play with them if I needed to help Kyle with something. They were just very friendly.
They're very supportive of families coming here and helping in the treatment, because those are the people that are going to have to handle the treatment once they get home.
Usually 1 day a week, each recreational therapist will take 3 to 6 patients out, and we'll just go for lunch. We'll go to a movie, do some activity, go to Meyer Gardens, any of the museums, just to get them back out. And then families encouraged to attend.
There have been times when we've had parents to stay where there's only one parent in the family and they have 2 younger siblings, not old enough to be at school, and no way to have someone to care for them. So they all stay. We have them to all stay in the room, 2 siblings and the mother. That's happened more than once. So that's meeting the needs of the patient. And I think that's the most important thing, meet the needs of the patient. And this in itself helps the child, who is the patient, to get better.
Rehabilitation means getting back to your life again and engaging in life to the fullest extent possible. The team at Mary Free Bed has the experience and expertise and knows 1,000 different ways to help.
He had so much drive and ambition despite having a very significant stroke affecting his speech and affecting his arm. And so what we did is we started focusing on how he's going to hold the golf club.
They found that Billy's main interest was golf, so they just spent time and figured out how to get him back to doing the things that he loves to do.
The therapists and the nurses and all the people around here never had a negative attitude. They were always upbeat and positive about anything that happened, whether it be like putting peanut butter on a sandwich or opening a milk. They were always there to support you, and they always brought you up with positive things.
I feel like it really restores hope, knowing that they can live life again. It may be just different. They may have to reinvent themselves a little bit, but the reality is they're still the same person.
With me personally have a spinal cord injury, I needed to kind of walk my talk. I kayak, I rock climb, I water ski, I do all these things. I hope that it'll, be something that they realize, okay, she got back to it and so can I.
Cameron was ready to drive before he was injured, and so now we're re-looking at driving again with hand adaptions. We could have done this locally where we live, however, we chose to come back to Mary Free Bed because we're that confident in them and that they know what they're doing, and so we would rather travel the miles and the hours. That doesn't make any difference to us whatsoever. We want to know that what we're coming for Cameron is the best thing for him.
Each day I felt stronger, and each day I felt more independent, to the point of where I drove out of here. And it shocked other people, and it still does, to see what I can do. It's like, well, gosh, how, she does all these things for herself, and it's like, well, of course I do, Who else is going to do them for me? Since having my accident and having to come through here, that they helped me be a stronger person and to face things and just to have confidence that I could do it.
Here there are patients with similar injuries and family members with similar stories. Mary Free Bed provides an environment that fosters support for families and caregivers and also between patients.
They support each other in a way that none of us as healthcare professionals would be able to do, because they can share with each other, and they do share with each other, what happened prior, what their life was like, what their life is going to be like. And it's a wonderful thing, and it's important that they do get that opportunity to spend that time together. And we certainly do recognize that and make sure that it happens.
He got to know the other kids in the facility, and they became like family. And they hung out when their therapies were done, and even the therapists, the recreational therapists would take them on outings, and they ended up becoming great friends. They gave him the tools and showed him that he was okay and it was going to be okay. And when he comes out from the hospital setting and comes home, he would make it at whatever it is he wanted to do in life. He needed to work hard at it, but he would have had to do that regardless. And I think what they showed him is that he will go on in life and he will succeed and more or less leave his own set of footprints, if you will, and he'll make a mark in this world, and it's going to be good.
At Mary Free Bed, hope isn't just a feeling, it's our promise. Freedom is the result of tools, training, and technology that help to restore mobility, normalcy, and dignity to people whose lives have been interrupted by injury or illness. Mary Free Bed Rehabilitation Hospital, restoring hope and freedom.